All right, let us talk about what is actually happening in surgical robotics right now. Not the sci-fi stuff, but the real systems being deployed, upgraded, and scaled globally. Because the fusion of AI and robotics in the operating room is not just hype anymore. It is reshaping how surgery is done, who can access it, and what outcomes look like. CMR Surgical, based in Cambridge, United Kingdom, just became one of the first to adopt Nvidia's IGX Thor platform for their Versius surgical robot. That's a big deal. IGX Thor brings more compute, better energy efficiency, and real-time awareness to surgical robotics. Versius itself is already FDA cleared, the first multi-port, soft-tissue general robotic-assisted surgical device to get through the de novo process. It's compact, biomimics the human arm, and is designed for minimally invasive access to the lungs, thymus, and esophagus. It uses collaborative arms and bedside units to give surgeons direct patient access, with flexible port placement tailored to each case. Now, with IGX Thor, CMR wants to push Versius into a new phase, one where AI delivers live insights during surgery and learns from every procedure to improve the next. Chris Fryer, their CTO, said it clearly. The goal of AI is not to replace surgeons, but to empower them. And Nvidia's not new to this space. In just 2 days, they have announced partnerships with Johnson & Johnson MedTech, Karl Storz's Asensus, Moon Surgical, Virtual Incision, Neptune Surgical, and Stereotaxis. That is a full-stack push into surgical robotics. Meanwhile, India's making its own moves, and they are bold. At the launch of the 450-bed Namo Hospital in Silvassa, Prime Minister Modi watched a live demo of Misso, India's first indigenously developed AI-powered robotic system for knee replacement surgery. Built by Meril Life Sciences, Misso is designed to enhance precision, reduce recovery time, and improve outcomes. It is a signal that India is not just adopting, it is innovating. Meril also launched the Mizzo Endo 4000, a soft-tissue surgical robot that supports general surgery, gynecology, urology, thoracic procedures, all backed by AI-driven 3D anatomical mapping and 5G-enabled telesurgery. That means remote operations are now viable. SSI Innovations is building affordable laparoscopic robots, and Taurian Surgical's AI-based 3D surgical microscope just attracted pre-seed funding from both Indian and international investors. The pipeline is real, and it is growing. India's market for AI-based surgical robots hit $176 million in 2023 and is projected to reach $901.1 million by 2030. That is a 26.3% increase. Globally, the market's expected to hit $25.2 billion by 2030. So yeah, India is not just building for itself, it is building for export. And the tech is evolving fast. Robotic systems now translate a surgeon's movements into micro-actions with sub-millimeter accuracy. High-definition 3D visualization magnifies anatomical structures up to 10 times, allowing for delicate procedures in hard-to-reach areas. In neurosurgery, robotics help navigate critical brain structures with millimeter precision. In orthopedics, they guide joint replacements with perfect alignment. In cardiac surgery, they allow for minimally invasive access to the heart, reducing trauma and speeding up recovery. Patients benefit too. Smaller incisions, less scarring, faster recovery, reduced blood loss, and shorter hospital stays. Some go home within 24 hours. Surgeons get ergonomic control consoles that reduce fatigue and improve focus. And because robotics minimize human variability, outcomes become more consistent and repeatable. Now, layer in AI. Machine learning algorithms are being trained to assist with decision-making, pattern recognition, and predictive analytics. AI can analyze pre-op imaging to plan the best surgical path, then offer real-time feedback during the procedure. That's not just precision, that's personalization. We are already seeing AI autonomy in action. Researchers trained a robotic system using the surgical robot transformer hierarchy model, SRTH, to perform parts of a gallbladder removal. It learned from real surgical videos, identified arteries, clipped them, made incisions, and eventually operated without human commands. Full autonomy is not here yet, but hybrid collaboration, that's already happening. India is also pushing into endovascular surgery. At KLS Dr. Prabhakar Kori Hospital, doctors used the Penumbra device, an AI-powered system, to perform a pulmonary mechanical thrombectomy via a transfemoral approach. That is selective clot removal with life-saving precision. But with all this progress, regulation has to keep up. In the EU, AI surgical robots fall under both the Medical Device Regulation and the upcoming AI Act. That means they'll need to meet strict standards for safety, transparency, and human oversight. India's ICMR released ethical guidelines in 2023, emphasizing transparency and patient consent, but they haven't yet addressed robotic surgery directly. That is a gap, especially with the Digital Personal Data Protection Act coming online, which will redefine how health data is handled. Challenges remain. AI's black box problem makes it hard to explain decisions mid-surgery. Data privacy is critical. These systems process massive amounts of sensitive info. Bias is a risk if training data is not diverse. And surgeons need training, not just in how to use the tech, but how to collaborate with it. Hospitals will need better infrastructure, faster networks, and interoperable systems to support all this. Globally, we need regulatory harmonization. Inconsistent standards slow down innovation and complicate safety assurance. A shared framework for AI validation, data governance, and clinical safety would help accelerate responsible adoption across borders. Bottom line, robotic-assisted surgery is no longer a niche upgrade. It's a foundational shift. From Versius in the UK to Misso and Mizzo in India, from Da Vinci's legacy to Nvidia's IGX Thor, the operating room is becoming a data-driven, precision-guided environment. If we get the ethics, training, and regulation right, this tech could democratize advanced surgery, bringing it from elite hospitals to rural clinics and from theory to practice. This is the future of surgery, and it's already in motion.